Colleagues, we have a quorum, and I'm calling the meeting to order. Et je vous souhaite le bienvenue au
And I welcome you to the Social Affairs, Science and Technology Committee.
Nova Scotia, and I'm chair of the committee, and I'm going to invite my colleagues to introduce themselves, starting on my left.
Art Eggleton, Senator from Toronto and Deputy Chair of this committee.
Hello and welcome. Panna Merchant, Senator from Saskatchewan.
Senator Lynn Bayak from Ontario, replacing Senator Neufeld.
Linda Frum, Ontario. Judith Seidman from Montreal, Quebec.
Carolyn Stewart-Olson, New Brunswick.
Thank you, colleagues, and I will remind us that today our meeting is called with one item on the agenda, and that is to deal with Bill S-211, an act respecting National Sickle Cell Awareness Day. This bill was introduced into the Senate by Senator Cordy in December of 2015, and it was referred to our committee on September 28, 2016. So we have with us today, and I will invite them to speak in this order. We have the sponsor of the bill, the Honourable Senator Jane Cordy, and she will be followed by representing the Sickle Cell Disease Association of Canada. We have Ms. Tunji Ajayi. Is that close enough?
Yes, thank you.
Thank you very much. Well, welcome to our committee and this meeting. And so, Senator Cordy, it's my pleasure to offer you the floor.
Thank you very much, Chair, and it's great to be here. And I have to say the committee works very efficiently since you were just given the bill last week. And I thank you so much for holding your hearings on Bill S-211. And it's a pleasure to have the opportunity to speak to each of you about the importance of Bill S-211, which will declare June 19th as National Sickle Cell Awareness Day. And I'm pleased that you've invited Londra to join me this morning. She's the President and Executive Director of the Sickle Cell Disease Association of Canada. And Londra is passionate about improving the lives of Canadians who have sickle cell disease. I'm honored to work with Londra and the wonderful advocates like her whom I've had the pleasure of meeting over the past few years. Honourable Senators, sickle cell disorder is the most common genetic disease in the world. The World Health Organization estimates that sickle cell anemia affects nearly 100 million people in the world. It is estimated that 5,000 people live with sickle cell disorder in Canada. Many others are carriers of the sickle cell trait, and they are often not aware that they are carriers. With sickle cell, the red blood cells become deformed. Normal blood cells are donut-shaped, and they move easily through the body's blood vessels to deliver oxygen to the organs. In patients with sickle cell, the red blood cells become stiff and sickle-shaped, and they do not function like healthy cells. A deformed cell does not flow easily through the blood vessels, and it can get caught up in the vessels and break apart. This can result in clogged blood vessels and low blood count or anemia. A sickle-shaped cell has a lifespan of only about 20 days, unlike a healthy cell, which has a lifespan of 120 days. The problem of clogged blood cells and low blood count hampers the body's ability to bring oxygen to the organs. This starvation of oxygen most commonly manifests itself as severe pain in the bones and can damage shoulder and hip joints or cause chest pain. There can also be damage to the lungs, heart, liver, kidneys, and eyes. A few years ago, I had the pleasure of meeting a wonderful young man at Anayi-on-Michore who recently has received a hip replacement because of sickle cell disorder. He spoke last Thursday afternoon at Advocacy Day on Parliament Hill with parliamentarians, and he reflected on the challenges of living a so-called normal life as a teenager when you have sickle cell disease. He is a courageous young man who remains positive about his situation. He's truly an inspiration to others. Honourable Senator, sickle cell disorder is hereditary. The disorder is passed on when a person inherits a sickle cell gene from both their mother and the father. At this time, there is no cure for sickle cell. Treatment consists of managing the symptoms. Research is showing that changes to a healthier lifestyle and diet have a positive effect on the quality of life. Of course, early diagnosis is the key. So why should we have a National Sickle Cell Awareness Day? Well, the United Nations, the African Union, and the World Health Organization have all recognized sickle cell disease as a public health priority. They have also recognized June 19th as World Sickle Cell Awareness Day to help raise awareness of the condition worldwide. I am pleased that my province of Nova Scotia has recognized June 19th as World Sickle Cell Day. I'd like to congratulate and thank Premier McNeil and Health Minister Leo Glavine and Rugi Jala, who is the president of the Sickle Cell Disease Association of Nova Scotia. Bill S-211 would add Canada's voice to this important cause by marking June 19th as National Sickle Cell Awareness Day in Canada. We are a diverse country, and many Canadians can trace their roots to sub-Saharan Africa, India, Saudi Arabia, and the Mediterranean, all regions where the sickle cell trait is common. It is important that Canadians learn more about this disease. I've been fortunate to meet many wonderful, courageous people who live with sickle cell. They would like Canadians to be more aware of the sickle cell disorder. They would like newborn screening to detect sickle cell at birth so that suitable treatment can begin immediately. They want treatment that will improve the quality of life of those with sickle cell disease and their families. They would like more education of health professionals, caregivers, school personnel about sickle cell. And Honourable Senators, they would like to see a national strategy for sickle cell disease. Honourable Senators, Bill S-211 would recognize June 19th as National Sickle Cell Awareness Day. It is just a start, a small start on the road to making things better. But last week when I attended the Sickle Cell Awareness Day on Parliament Hill, those present were excited and hopeful about this bill. They're excited because it means that people, particularly parliamentarians, are listening. It means that on June 19th of every year, there will be an opportunity to raise awareness about sickle cell disease to all Canadians. Committee members, I thank you for your interest in Bill S-211, and I look forward to your questions. Thank you.
Thank you, Senator, and I will now invite Ms. Tunji Ajayi to make her presentation.
Thank you. Good morning, Honorable Senators. I'd like to thank you for inviting me as a witness this morning, and I'd also like to thank Honorable Senator Cordy for introducing Bill S-211. Sickle cell disease is a multi-system genetic blood disorder. It affects every organ of the body, including the eyes, your kidney, the liver, spleen, the brain. We've witnessed stroke in children as young as 2 years of age, and we've seen blindness caused by this disorder. Premature death continues to happen. Worldwide, sickle cell disease affects many children. Over 300 babies are born every year with this disease. We also have over 100 million, as Senator Cordy said, that carries the trait for sickle cell disease. The issue here is when you have the trait, it means you have one form of this defective gene. And what this means is there's no symptom. You continue to live life as if everything is okay. And this is why many individuals with the one form of the gene continue to procreate and have children, and many realize their sickle cell status only when their children are born with the disorder. This, among many other reasons, was why the United Nations encouraged its member countries, member organizations, and their agencies to raise awareness. They designate June 19th as one day that every member country and their agencies can raise awareness around sickle cell disease. They also encourage these nations to also have national programs to support individuals with sickle cell disease. In our country, in Canada here, just a few years ago, we estimated number of the affected to about 2,500. based on our centers of excellence. Again, there's no national registry, but we're based on those that go to the designated centers. But I can tell you, as of today, the number has quickly grown to 5,000 individuals. I can also say I was in Nova Scotia in June to celebrate World Sickle Cell Day. And in 2014, Nova Scotia approved babies to be screened in that province for sickle cell disorder. Their one-year report card showed 3 babies were flagged with sickle cell, but 63 babies were flagged with the traits. It is these babies that will grow up with our awareness, not be known, we procreate, and we have more babies with the disease. Bill S211 will support awareness. It will support education around sickle cell disease. Individuals that carries the one form of the gene and thereby have no health issues and no way to know will now be able to be aware and get tested. And they'll be able to make informed decision before having their own children who may end up coming up, being born with sickle cell disorder. Honorable Senators, I implore you that this bill will not cost the government a dime, but it will help to increase awareness and education around sickle cell disease in our country. It will help to reduce the number of babies born in Canada with sickle cell disease. It will also help to improve the care and treatment. Currently in Canada, many of the care providers are ill-equipped in taking care of individuals with sickle cell disease. As Senator Cody pointed out, sickle cell disease affects every one of us. It affects those, mainly though, whose ethnic background are from, they are Caucasian from Southeastern Europe. It affects people from South Asia, Mediterranean, Middle East. This is the faces of Canada. It is a diversity, and we need to ensure that Canadians receive adequate care, and this will start with raising more awareness about sickle cell disease. I implore you to help make sure that Bill S211 move and pass law in Canada before the end of this year. Thank you.
Well, thank you both very much. And now, colleagues, the remainder, we will open the floor up initially to questions from the committee, and we will follow that with clause-by-clause consideration. So, I have on the list at this point Senator Eggleton, followed by Senator Stewart-Olson, to be followed by Senator Merchant. Senator Eggleton.
Well, thank you very much for your presentations, and thank you for sponsoring this kind of bill, Senator Cordy. When you see a statistic that says this is the most common genetic disease in the world affecting some 100 million people, and you can see why a bill like this is needed, because I don't think enough is known, certainly by people in our country, about this disease. And creating an awareness day, and with awareness programs growing out of that, will certainly help. To get a little bit better knowledge about sickle cell disease, let me ask you, first of all, how is it detected? One could imagine that a simple blood sample would be able to detect it, but it's more than that, I take it.
It starts off, it's certainly a blood sample, and that's why many provinces, including Ontario, it used to be just Montreal and Laval, but now, fortunately, it's the whole province, New Brunswick, Nova Scotia, British Columbia, at least, I may be leaving a province out, have initiated a simple blood test for every child who was born, and this simple blood test only costs a couple of dollars, and then immediately they're able to determine whether or not the child has sickle cell. And early intervention, of course, in providing care for the child makes a huge, huge difference. And you've said not enough is known, and I heard the story. I spoke to the parents last Thursday, but I also heard their story a year ago. And their young child, they brought their young child to the hospital with severe pain in his arm, and the doctor on duty in the emergency department said, well, your child must have fallen, I'm going to give you Tylenol. And so the parents went home and treated the child with Tylenol, and 3 or 4 days later the child was still in excruciating pain, screaming They went back to the emergency department again. They were most fortunate because the doctor who was on duty had just come back from a session dealing with sickle cell and decided to give a blood test to the child, and they found out then that the child had sickle cell, and then they were able to start a treatment program. Neither parent realized that they were carriers. And of course, both mother and father have to be carriers for the child to have the disease because it is genetic. So your point about not enough being known is absolutely true.
So there are some symptoms that a physician would attribute to this kind of a disease would be the first trigger to then get a specific blood test to determine whether the person has it or not. That's how that works.
Yes, so in some of so there are many provinces now screening newborns. So for those babies who are born in those provinces, moving forward, they will be screened and they will know that they have disease. But again, for those babies that were born, children that were born prior to when newborn screening starts, depending on when it starts in each province, it will be based on symptoms or, doctors who may be enlightened a little bit about sickle cell to feel, well, if this child has swollen hands and swollen arms and they didn't think this child fell, or this child is crying and nothing is pacifying this child, it could be the child is having vaso-occlusive, So again, it is symptoms. But for adults who maybe carry the traits and don't know, we are encouraging them to go to their family doctor. It's a simple, when you go to your family doctor, you get a requisition to the lab to do blood work. A simple mark on the same requisition for sickle cell test will show you if you have sickle cell disease. In provinces like Ontario and others that have provincial health programs, there's no additional cost. It's all covered by your provincial card, again, to get tested for sickle cell disease.
Now, I take it that most of the people that coming off whenever I reach my time. I take it that most of the people who are susceptible to this disease are people because of origins in places like India, Saudi Arabia, the Mediterranean, or sub-Saharan African countries. Is that the vast majority would be people from there?
Yes. So again, there is a connection between malaria in sickle cell that historically they found that in areas of the world where the malaria-borne mosquitoes are prevalent, also those areas have sickle cell disorder. It's been explained that it is Mother Nature trying to prevent itself against malaria that kind of mutate one of the genes. And so if you have just one of the gene, you find that you actually have some kind of a protection against malaria. But if you now have two forms of the gene, that's when you have a big problem with the disease. So again, yeah, you're very accurate. But again, we always say that sickle cell disease has no color because, again, it also affects Caucasians from Europe. And so having every Canadian actually get tested for sickle cell will be the best way to move forward.
One other question. Is there a cure?
There is one form of cure, which is stem cell transplantation. But again, we know that comes with a very high price tag. It also comes with you finding a compatible donor. So again, it's not viable for everyone. So we're thinking at this point, prevention. Preventing more babies is the way to go, and it's by awareness, it's by education that we can get that achieved. Once we have that in place, then again, we can see that more healthcare providers will be more educated around this disorder. They will have more interest, and again, treatment will improve, and there will be a better quality of life of those that are affected by sickle cell disorder.
Okay. Thank you.
Thank you, Senator. Senator Stewart-Olson.
Thank you, Chair. Thank you for your presentation. It was very enlightening on the new things. I just wanted to encourage you on the awareness aspect because I think, well, I've actually seen patients coming into emergency departments in pain, either undiagnosed and they're sickling, but even diagnosed, many times they are looked upon as simply after pain medication, after drugs. And that's really pretty horrifying when so many of these people are in acute pain and to be sent home not being believed. And sometimes they're not even diagnosed, but in some cases they are diagnosed and there's still that kind of, do you have any experience with that?
Very accurate. Senator Holson, that is actually what we're dealing with. They stigmatize our patients as drug seekers. And again, and I don't think it's because they are wicked, it's because they don't know. It's ignorance. And this is why education is important, even among the care providers. Because again, somebody walks in and said, well, I am on morphine and I'm in pain. The red flag goes on, and it's like, drug seeking problem here. And so even the patient is saying, no, I have sickle cell. This is what I'm being given. This is what I take. This is my medication. They flag them. And I remember just about a few years ago, a young man that goes to school in Niagara Falls area called me at 2 a.m. and said, Lena Ray, they won't treat me at the hospital. And I'm in pain. And I don't know what to do. And I'm like, well, I'm in Barrie, Ontario. You are in Niagara Falls, Ontario. It's 2 o'clock in the morning. Can you go to a different hospital and see, and then we deal with this after? So again, it's a big problem, and we see that every day. And I really think more awareness will lead to more education and improved care, even in this area.
Yeah, I think in mainly in emergency departments and local family medical centers, because these people present looking very healthy. You look good, and you say, I have this terrible pain, and, people kind of go, oh, yeah, okay. But anyways.
Just on that point also, and I heard from parents and of teenagers, and it's particularly true when it's a teenager who is presenting at the emergency department with excruciating pain, and immediately, as Lorna said, the red flag goes up. They are just seeking drugs. So
yeah, because
for young
they ask
people,
for the medication. Anyways, and just if you could, just one more, Chair, if you could tell me how you got involved with the sickle cell and how you became such an active person.
Thank you for the question. So, again, I have parents that had both, they had medical backgrounds, but again, they were both healthy, they both carried the trait, and they didn't know. So they got married, and they have me, and I did not even have the trait, let alone the disease. But they had my brother, who had the full-blown sickle cell disorder, and I have other siblings with the disease as well. Unfortunately, my brother passed away in 1999 at the age of 30, and he was an engineer. He wanted to live life. He wanted to do things. He was told to go to school. He did that. He did all he was asked to do, but his life was cut short. And for myself, I am healthy. I don't have the disease, and I feel that I could be the voice and help those that have the disease. Many times they're too sick to advocate for themselves or put their points across because of the disease. We can be the voice for them, and that's what I've chose to do. And that is the way. That's my reason for being, for being an advocate for sickle cell disorder.
Thank you very much, and thank you, Senator Cordy, for bringing this forward. Thank you, Chair.
Thank you, Senator. Senator Merchant, to be followed by Senator Meredith.
Welcome, and I thank you for coming this morning. And Senator Cordy, I also thank you for raising awareness, helping to raise awareness, because I know very little about it. I don't know anyone personally. I mean, somebody that I know may have it, but I'm not aware of anyone that has it. So I don't understand a lot of things about it. I gather that this bill will raise awareness, which I think is important. You said that the UN is encouraging its members. First, maybe in your questions, you could tell us how many countries have declared the day. Secondly, how are you going to promote it on that day? There are many other days where we wear a ribbon or we do something to have other people ask us, why are you wearing that? What does that mean? What is the little pink ribbon about? And you said it doesn't cost anything, and that prevention is what you are aiming at. How do you prevent the disease? You mean that people that have carriers ought not to have children? Are there some things that they can do? And exactly what is the cost of the treatment?
Thank you.
To people that have it, how costly is it?
Yes, so
Those are all my questions.
I'll take
Thank
your.
you.
It's a few questions you've asked. I'll take one at a time. So, how do we prevent sickle cell disease? By people even knowing that they carry the trait. I often heard parents say, if I had known that I'm a carrier, and my partner is a carrier, perhaps I would choose a different partner. I've had parents say that when they go through the pain that their child goes through with this disorder, and they realize it's not worth it. So again, we ask people to get tested and make their own informed decisions. And even if you still want to be with the same person and you may still end up having, this child with sickle cell disease, again, knowing ahead of time and and educating yourself, what are the treatments available, what do I need to do, how do I need to do, can also help to reduce the heartache and the confusion that comes with just being told out of the blue your child has sickle cell disease. So again, there are ways that people can again know that, okay, if I have the disease, I will make this decision or that decision. I always say that having a child with sickle cell disease is such an expensive situation that should not be imposed on you due to ignorance, not being known ahead of time. So again, having that knowledge is key. It is important. Number two, you also ask, how would they be promoted in Canada? A lot of activities. United Nations encouraging a lot of awareness activities, education activities. We will have, of course, the pins and stuff like that will be worn. We would raise awareness all across the country. This year, as a matter of fact, we did a national blood drive to support the National Awareness Day. Even though it's not the law yet, we did all over the country because, again, many of the individuals with sickle cell disease are on continuous blood transfusion. And they need to get blood from their own community to be best matched. We call the phenotype matched blood. So to ensure we have adequate supply for them, we use that as a national activity that we did. So we will have those kind of activities and other activities, as well as having our bracelets worn and distributing that nationally, and the pin and everything. Those are some of the activities that we will do to promote that day. Now, you also asked the question about how many countries in the world currently are recognizing that day. I believe in the Treatment Act in the United States, recognizing June 19 is part of that act. That is law in the United States of America. I also believe UK is also in line with the June 19. There are many African countries and other European countries as well that are also supporting UN on this initiative. Did I answer all your questions, or did I miss anyone?
I'm not sure. I asked you so many questions.
So many questions, that's what I realized.
Thank you for trying to answer as many as you can. I think you did answer the one about that it is an expensive disease to treat. And is it because of the transfusions, or what is the expense? Is it the medication?
Well, I'll tell you, when you have a child with sickle cell disease, many parents have to miss many days of work, and so end up losing their job. Because then if you say to your employer, well, my child is sick and I'll be away, and you're away for 2 weeks. Then you went back to work. Then in 2 weeks again, my child is sick again. You get to a point the employer feel like maybe you should stay home with your child. And so many parents are not working because their child are very sickly. And so it's very expensive even to the system that at the end of the day, unfortunately, and I'm not sure if this is politically correct, we find that when you look at the statistics in Canada, spouses, many marriages get broken because partly of the stress associated with having a child with sickle cell. We find that to be very high. As a matter of fact, I was in a summit on sickle cell disease in Austria last year, and I was saying, well, maybe I would put the divorce rates or marriage breakdown to about 95, and this lady from UK said, well, I will put UK's rate to about 99. So it's really high. It's an expensive situation to be in. The families need to really think carefully, know what it entails, what would this cost us as a family, what will it cost the child. Senator Cody was talking about Mr. Hadiniye, a young teenager with sickle cell disease. At the age of 17, he's had 2 hip replacements. That is debilitating for a young adult. So again, families go through a lot of stress, marriage get broken down, people lose job and everything. So knowing your trait, making informed decision, knowing what this will mean if we're both carriers and we want to go ahead, or what are the other medical options What can we do in pregnancy? Can we check? And what can we do about that? There are so many options that individuals can discuss with their doctors before having a child with sickle cell disease.
Thank you, Senator. Senator Meredith.
Thank you, Mr. Chair. Thank you so much, both of you, for being here this morning. And I also wanted to be on record to lend my voice to Senator Cordy as she introduced this bill in the Senate, that it affects so many Canadians, and we need to do this for all Canadians. And to have this day in Canada is so important. And I want to thank you again for your advocacy and for you not standing by the sidelines and, you know, allowing this disease just to continue. You've been personally affected by this, and so I thank you for your advocacy as well. I've also have family members or family friends who have been affected by this disease, and that's why I'm also personally connected to this bill. And to see the suffering that they've gone through, and you talk about, and my question to you will be about the crisis that victims find themselves in and how they deal with that in terms of coping. But in terms of families who have been affected, there have been where they almost to the point, I know family members who thought of just taking the lives of their own children simply because of the pain that they were in. And friends have lost friends that have had this disease. So talk to me about the support for those who are in crisis and how they deal with this disease.
Thank you, Senator Cordy. I'm sorry, Senator Meredith.
She's better looking than
I guess I deal with her a lot. Thank you, Senator Meredith. Very important question you have asked. I'm going to go back to my own experience. I remember in those days my brother would be in excruciating pain, and he would say, "I'd rather die than continue with this pain." And I would be, who would want to die? Life is so good. And she said, "You don't understand. Be in my shoes for one day, and you don't want to be here." And I remember he would ask us to walk on his back, and that would be painful. He said, "Honestly, I would like to distract myself from this pain and have any other pain." And I've also spoken to a 5-year-old in Canada here to say, "Honey, can you describe your pain to me?" And she said, "It's like someone breaking bottles on my back." And I'm asking them to stop, and they won't stop. And I'm crying, and I'm saying, "Please stop. The bottles hurt," and they would not stop. So yes, I have also asked my own sister, who lives with sickle cell disease and still alive, and she's also gone through childbirth. How would you consider sickle cell pain and childbirth? And she said, "I will give birth to babies every day rather than the painful crisis." Individuals with cancer have expressed that cancer pain is far better than sickle cell pain. So this is why, as Senator Halson said, when they present and they say, "This is what will cut my pain," Tanelan doesn't cut it, it's morphine. And other drugs as such, morphine. The healthcare providers don't understand that if they're not in tune with sickle cell disease as they should, and they think that they're seeking for drugs. So how do we support those that have sickle cell disease? One of the things that we do is we do what we call lunch and learns, and go to the hospitals and put up education sessions. But again, while it's great, it's not 100% effective, and I'll tell you why. Not every care provider in the hospital will have access to those meetings because they are there serving patients and families. So again, it's not enough, but we're trying to educate and raise awareness, to support the patients. And I've personally gone to many hospitals with many of my patients to meet with the directors in the emergency rooms and to say, "This patient came and was put aside for 12 hours. You didn't believe he was in pain, and they have to be self-medicating themselves while they are in a Canadian hospital? It's not acceptable." And so, just like you said, Senator Halson, they look okay, they're in pain, they're screaming with pain, but, well, you sound okay to me apart from the pain that you're screaming. How do I really believe you? So there's more education that's needed. Yes, some work has been done, but it's not enough. And I believe the National Awareness Day will help increase more awareness and thereby encourage more healthcare providers to seek more education around sickle cell disease and treat the patient not only with dignity, but also to treat them on time. It's been researched and said that if you present with sickle cell pain, you need to start getting medication within 30 minutes of that pain presentation. If you kept for 12 hours without being taken care of, what happens is you will end up spending longer time on admission in the hospital. That is cutting into the healthcare cost. There's a cost affected here. So with more education, there's reduction in the cost that goes into taking care of the patients as well. I've put together a simple health economics around sickle cell disorder, and we've said, okay, on the average, a patient will have about 6 admissions a year minimum. And each admission, and this is non-ICU admissions, will cost the system about $20,000 each time. Well, in a year, it's about $120,000. Having better care can reduce admission to 1 to 2. There's a simple drug called hydroxyurea, and I'm sorry if I'm going a little bit off topic. There's a simple drug called hydroxyurea. It's a very cheap drug relative to admissions in the hospital. You can, even without any provincial plan, perhaps about $300 a month per patient, it can save 5 to 6 admissions a year. That's part of what we're talking about. We're talking about national strategy, but we want to start with having this day recognized to raise awareness, improve education, and thereby improve treatment and care, and improve the quality of life of those who are affected. Less admissions. Thank you.
I just have another question, Mr. Chair. With respect to this National Day, which I fully 150% support, and I hope the rest of the committee members also will support as well. The collaboration with the Ontario Sickle Cell Association, Lily Johnson, who I had an opportunity to present an award to last year as she was on the Hill.
Thank you.
And her advocacy. What is the collaboration with the international agency and the local agencies in terms of promoting of this day?
Thank you. So the National Association has 6 member organizations in Canada across 5 provinces currently, and Lily Johnson Group, called the Sickle Cell Association of Ontario, is one of the member organizations. So wherever we do at the national, every member group will support at their localities. In Nova Scotia, we have the Sickle Cell Disease Association of Nova Scotia. In BC, we have the Sickle Cell Disease Association of British Columbia. In Ontario, we have 2 member groups, the Sickle Cell Association of Ontario and the Sickle Cell Awareness Group of Ontario. We also have the Sickle Cell Association of Quebec, and so on and so forth. So all of these member groups will support the National Awareness Day. We all came to the Parliament Hill. I know you were not around, but we all came to Parliament Hill last week, and we raised awareness on the Parliament Hill. Thank you.
Thank you so much. Thank you so much. Thank you, Mr. Chair.
Thank you, Senator. Well, thank you to our witnesses. I think you've given us a very clear illustration of that's helped us understand to a larger degree the nature of the disease, its cause, and the impact, and that is very clear. So, at this point, I move into the next stage, and colleagues, would you agree to invite the witnesses to stay through clause by clause? So you are welcome to stay for the clause by clause portion. And with that, I will move to clause by clause. And I will put each question to you. And you will either agree or disagree with each clause. And the first one is that I must ask you, is it agreed that the committee proceed to clause-by-clause consideration of Bill S-211, an act respecting National Sickle Cell Awareness Day?
Agreed.
That's agreed. Shall the title stand postponed?
Agreed.
Shall the preamble stand postponed?
Agreed.
Shall Clause 1, which contains the short title, stand postponed?
Agreed.
Shall Clause 2 carry?
Carried.
Carried. Shall Clause 3 carry?
Carried.
Carried. Shall Clause 1, which contains the short title, carry?
Carried.
Carried. Shall the preamble carry?
Carried.
Carried. Shall the title carry?
Carried.
Shall the bill carry?
Carried.
Carried. Does the committee wish to consider pending observations to the report?
No.
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 Thank you. That was a no. Is it agreed that I report this bill to the Senate?
Agreed.
Agreed.
Agreed. Well, I would say that the mover of this bill and the witness have done a magnificent job of convincing this hard-nosed committee to support with such speed the motions, and I will definitely, on behalf of the committee, report this to the Senate. And there being no other business, I declare the meeting adjourned.